Talking health matters now. The need for girls and women to go for early cervical cancer screening was stressed at the Cervical Cancer Prevention Project for girls and women in Lagos. Senior correspondent Ivy Kano has the details.
Cervical cancer is the fourth most common cancer amongst women globally, with an over 600,000 new cases and over 300,000 deaths in 2020. About 90% of the new cases and deaths worldwide in 2020 occurred in low and middle-income countries. To this end, such gathering here in Lagos is important.
Something that could have been prevented had ignorance made her die.
We also have making vaccines available for girls ages 9 to 26, encourage vaccinated women and girls to tell others to come for vaccination.
These are some of the ideas these groups drawn from across Nigeria intend to pitch at this for girls and women HPV project.
They self-test something, so it's something that when they come, they get to use it and then give it back to us. So we intend to send it to the University Teaching Hospital, where we have medical practitioners that can actually take this step forward to take it to the lab, conduct the test, and then get back to us on the result. Then when they get back to us, we'll get back to these women.
Is to go to each communities to make them aware of cervical cancer, because many people in the north don't know about cervical cancer, let's be sincere.
Awareness and others were identified as some of the factors militating against the prevention of cervical cancer in Nigeria.
People, when they have cervical cancer or discharge or bleeding, which is the early symptoms and signs, they don't believe it's cancer. They think it's sexually transmitted disease or witchcraft. And this is very common sexually transmitted infection that has no symptoms or sign until it gets to the advanced stage when it causes cancer. So they need to know what should they do. It's 100% preventable.
We received 525 entries across the whole country. Shortlisted 15 teams. We are now deciding for the top 7 ideas. The idea that works well is what we are now going to take up to the 30 local governments across the country.
The program is put together by Nigerian Institute of Medical Research, Yaba, supported by the National Cancer Control Program of the Federal Ministry of Health, and in collaboration with St. Louis University and the University of North Carolina, Chapel Hill in the United States. Ivy Kano, TVC News, Lagos.